Hello, everyone. Thank you for joining us for today's webinar. We have Dr. Deepti Adlakha with us. She's an associate professor and Delft Technology Fellow in Department of Urbanism, Faculty of Architecture and Built Environment. And she's a Fulbright scholar and an interdisciplinary scientist with a diverse educational background. She holds a degree in architecture, urban design, and public health, a very unusual combination. Sorry. Yeah. Sorry. Yeah. Her primary focus of research is in terms of addressing physical activity. But as physiotherapists, we mostly look at biological factors in terms of changing or improving mobility, whether a diseased population or a special population. But today she'll give a perspective on in terms of how designing and architecture, that is external environment, and how that can influence activity. At the same time, what can be done in terms of changing those factors in physical mobility. Right. So that's the focus. I hope you all enjoy a different focus. And I'm sure for physiotherapists to listen from a person with an architecture background would be an interesting combination. We are looking forward for an exciting presentation. Dr. Deepti, you can take over now.
Thank you. Thank you so much. It is actually unusual for me as well to present to a group of medical and health professionals, and all of you are experts on the biological level and the cellular level. But what got me interested in the work that I do is I spent most of my life in India. I studied there. I did my bachelor's in architecture, but growing up and seeing the way our cities are rapidly changing and urbanizing and how our lifestyles are getting affected, probably for the worse now, got me interested in understanding how there are bigger systems changes that are needed and why it is really important for all of us to work together. And as Dr. Prakash just said, it is important that we look at this from a systems approach. So not just the biological and cellular level, but also try and be advocates for our environment and see how we can make changes. And some of the examples that I present today and some data that I present today is work that I have been doing. It might seem very built environment, city planning focused, but I do have some examples showing how you can be advocates for your communities and make sure people are living healthier lives. So a quick overview. I'm going to just briefly start with an introduction. Everyone knows why physical activity is important. So I'll focus on the social determinants of health. This is a key phrase that we use in our research when we talk about the big picture, broader systems changes that are needed to help ensure that people lead healthier lives. I'll focus on some environmental influences and tie them in with two specific projects that I have led in India. And then I'll end with a call to action and show you some examples of different cities in India that are doing things to make sure their residents have more outdoor space for physical activity and for overall mental health benefits. So we all of you know what physical activity is and why it's important. I've just put the definition up there as a brief introduction, but it is any bodily movement that is produced by skeletal muscles. What is really important to note is that physical activity includes all types of movement, and this can be when you're working, it can be at home, it can be during your leisure time or recreation, and it can also be when you're traveling. And we'll get into some of that a bit later. So it is not specifically activity that you do with a specific purpose, like going to the gym. Physical activity can be included in our everyday lives, and this is why our environment plays a greater role. And it could be moderate and vigorous intensity, and both have their benefits in improving health. So as you can see on the screen, the deaths attributed by country level are displayed, and physical inactivity was ranked number 4. So it's the 4th leading factor globally for mortality. And the colored bars represent the income of the countries. And as you can see, the middle income and low income countries have a greater percentage of physical inactivity as a risk factor. And India falls into that category. So this is extremely important to note. And of course, there are other related factors to physical inactivity that we are seeing in our cities now, with rising air pollution, overweight, obesity, diabetes. All of these chronic illnesses are on a steep rise. So the role of physical activity as physiotherapists, I'm sure all of you know this, so I don't have to dwell on it too much. There is strong evidence of health benefits across all age groups, right from children. There is also research done in toddlers and babies about their development, and as they're growing up, how important physical activity and fitness is. In adults, there's a range of chronic diseases on the screen that are listed. And of course, with older adults, there is falls, frailty, physical function. So physical activity has a range of benefits across all age groups. So now we'll zoom out a little bit. That was at the biological level, at the person level. When we think about physical activity, we often look at how much the person is being active, but we often fail to analyze why or where they're active. So this chart on the screen is a brief description of how, if your neighborhood is activity friendly, so if it promotes walking, cycling, public transportation, it not only increases physical activity, but it also reduces greenhouse gas emissions, which is becoming increasingly important in today's world with the climate crisis, which then leads to healthy and sustainable cities. So this is a project that I'm involved with, and I'll come back at the end for this, but I just wanted to introduce that it's not just health that is a benefit, but there are also a lot of other co-benefits like reduced greenhouse gas emissions. However, the irony is that we are building our cities and neighborhoods where we have to go to a special place and physical activity is treated as a special occurrence. We have to carve out time to go to the gym, to exercise, whereas the physical activity that we used to be able to get in our daily lives through walking and cycling is slowly just completely vanishing from our cities. So this is a cartoon from the New Yorker, a very popular magazine that I like to refer to, because sadly we're seeing this even in India now. So how did we become inactive? And again, another irony here is that the abbreviation translates to sloth here. We're seeing changes across all sectors of our daily life, whether it's in leisure, occupation, transportation, and our household work. We're increasingly relying on automated gadgets, devices, and becoming increasingly sedentary. And this is called the change in our lifestyle, which is leading to lifestyle-related diseases. So we spoke a little bit about the individual influences, biology, that is important. We opened with that, looking at genes, weight status, the medical status. But what we also need to pay attention to is social influences and environmental influences. And increasingly, research is showing that the environmental influences can play a role for as much as 25% of a person's health. So whether it's how the neighborhood is designed, how the city is designed, you have access to good transportation, you have access to green and blue spaces. Do you have a network of family, friends, and peers that also participate or encourage you to be active? And then the role of electronics, devices, culture, and media in our daily lives. So this is what we call the social determinants of health. And as I started by saying, we have to look at a systems approach. So if you see the immediate circle in yellow is the individual determinants, and that is your age, your skills, your biology. And slowly that expands into a nested framework where the social environment, the built environment, and the natural environment are all exerting an influence on the orange circle, which is how active you are. So this is what we like to analyze. And in my field, what we focus on are the top 3 circles. So starting with the natural environment, the built environment, and the social environment. And this is an example of the interdisciplinary pathways. So in brief, you can see on the left is the population. So that's all of us here on the call today. Where we live, which city we live in, which neighborhood we live in, how that is designed, the layout, that affects our spatial location. And then that in turn affects our mobility choices. So are you constantly relying on a car to go to work, your own private mode of transport or an automobile? Do you have the option to use non-motorized modes of transport? Can you walk to a bus stop easily? Or do you have good access to a train station? And that in turn determines how active you are in a day, which down the road affects chronic disease, mental health, violence and injury, and overall physical well-being. So these are some of the interdisciplinary pathways. And hopefully by looking at this, you can see the connection between biology as well as the environment. So at the macro level, cities can be designed to move people or designed to move cars. And activity-friendly neighborhoods are defined as those which have mixed land use. So in your neighborhood, do you have access to shopping areas, to parks, to green spaces, healthy food, how connected the streets are, the level of density, and access to recreation resources. In most Indian cities, you will find that these factors are very common, yet people are not very active, and we'll come to why that is later. This is also because at the micro level, even if we have density, even if we have good land use mix and we have access to our everyday amenities at a close walking distance, what we are finding is that the quality at the micro scale is not favorable for pedestrians or cyclists. So the quality of our footpaths, the design of our roads, whether there is street furniture, whether there's shade, aesthetics, how clean the neighborhood is, whether you feel safe walking outside. These are the micro level factors that are increasingly important in Indian contexts. So a quick example of one of the studies that I led, it was called Can We Walk? And this was focused in the city of Chennai. You can see one of the quotes on the screen of local residents aspiring that they want to experience walking and cycling without fear of injury or intimidation. And there were many, many such quotes. So this study actually surveyed several neighborhoods in the city of Chennai and led to the development of a walkability scale. So it's freely available. Right now it's available in English and Tamil. Anyone interested in surveying their neighborhood and coming up with the walkability score can use this tool and understand which areas or which sections of their neighborhood need improvement. Some other quotes from the focus groups that we did. A lot of the residents, of course, spoke about the traffic safety, a lot of accidents occurring. There was a lot of mention of 2 extreme age groups, so children and older adults finding it very difficult to walk. This is an example of some of the results, and this slide shows some of the results from the study. I won't focus on the odds ratios, but on the left of the screen, you can see the colored bars. These were the most prominent factors. So as I mentioned at the micro scale level, aesthetics really were important. A lot of people complained about lack of shade, lack of cleanliness, walking and cycling infrastructure. There was a lot of land use mixed diversity, but the more diversity there was, the better were people's odds of walking outside. And the same with pedestrian and traffic safety as well. So the ones on the left, the 4 long bars that you see, those were the prominent factors that we found in these neighborhoods where people were more likely to walk or cycle or generally be active with the presence of these 4 factors. So what was the impact? Now you may be wondering, well, yes, as physiotherapists, as public health professionals, we work with people at the individual level. So how can we play a greater role in our environments? And this is what I will continue to highlight for the rest of my presentation. As a result of some of this research and sharing it with the local municipalities and maybe creating awareness of this through newspaper articles, as you can see, a lot of cities in India now have temporary street closures. So sometimes over the weekends or at least once a month, large sections of the streets are closed to automobiles and open for people to be active outdoors. That is a good first step. What I would like to see also happen is that schools in cities in India start designating safe routes to school and also to work. Safe routes to school is a large movement in a lot of Western countries where they designate neighborhoods and routes where children can easily walk or cycle to school. In the evenings, joint use and shared spaces. So some school playgrounds that are not being used in the evenings can be opened up so that the residents nearby living in high density, small apartments or homes have some outdoor space to be active outside. Tactical urbanism is another topic that I'll cover in another slide, but these are small, very fast, cheap changes that are made to street infrastructure. They could be converting a couple of parking spaces into a park. Very narrow, very small, but at the same time, very effective in extremely dense regions such as India. And also more awareness of pedestrian safety and Vision Zero. Vision Zero is a movement that aims to reduce pedestrian deaths. So these are some of the initial ideas that can emerge, and it needs everyone to work together and collaborate. One other quick project that I will touch on is a study I did focusing purely on school-going children in 4 cities in southern India. You can see from the screen how obesity prevalence in Indian youth is a critical problem. It has the largest adolescent population in the world, and India is predicted to have more than 27 million obese people, which is 1 in 10 children globally. So this is an age group we increasingly have to focus on. A lot of, at least in my experience, physiotherapy focuses on older adults, frailty, falls, but we have to start looking at even the younger age groups in our country. This report card is a good place to start. And I would say this is where we can start advocating for better physical activity guidelines in our country, and also more funding from the government focused on this. As you can see, this is tracking the physical activity, sport participation, play, transportation, sedentary behavior, and also the social support that people get. For 3 out of these, we have incomplete and insufficient data to even give a grade. And for the others, you can see that India is really not performing that well. We have grades of B-, C, and D. So none of those are good. And that really sheds light on why we have to focus on childhood obesity in India. One key finding from the project that I did, which might be surprising, but the weekly MVPA stands for moderate vigorous physical activity. And you can see low-income children belonging to low-income families were more physically active than middle and high-income families. So they were probably more active going to school, walking and cycling to school, whereas the high-income and middle-income kids were more sedentary. Also, clearly goes to show that income plays a very important role. Traffic safety was another factor, which is also not surprising. You can see that in the purple graph shows neighborhoods which had the highest traffic safety, which had better roads, better infrastructure, physical activity was the highest. So again, not a surprising finding, but clearly an important case to make. And similarly, within the low and high traffic safety quartiles, you can clearly see the distribution with income, low, middle, and high income. And participants in high income neighborhoods had were more physically active than low in this case. So why is this important? As I mentioned before, safe routes to school, you can clearly see from these scenes how people struggle to cross the road. There's basic lack of pedestrian infrastructure. So if there can be policies introduced at the micro level, at the neighborhood level, at the school level, and this is why we need to advocate. So if you, as a group of physiotherapists, can come together and present a scenario to your local municipalities, or even write an editorial talking about these issues, it will have a lot more greater impact than city planners or architects trying to do this. Some scenes from the project that I did, you can clearly see how children in urban areas also lack safe places to play and be physically active outside. I'll then go on to highlighting a key resource. This is called the Global Action Plan for Physical Activity, and it has four major areas of work, focus areas. The mission is to create safe and enabling environments so people can be physically active in their daily lives. And they target a 15% reduction in the global prevalence of physical inactivity in adults. So create active societies is one of their aims. And there are specific policy actions within each. So I'll just quickly go through the 4 objectives. The second one is create active environments, which I presented a few examples before. The third one is create active people. And the fourth one is create active systems. Now, how we implement this and how they go hand in hand is where we need to partner and work with each other. So on the left, you see there are settings for physical activity. As I mentioned, physical activity can occur at home, at work, at leisure, during transportation. And this expertise, so as medical professionals, how many of you talk to planners or take initiative in your neighborhood? Talk to parks and recreation departments, go to schools and advocate for safe routes to school. Encourage this awareness, even simple things like creating awareness of why this is important. That's a good starting point, especially in a country like India, where we're quite a lot behind in implementing these policies. So some more snapshots of where we can intervene. These are some examples of play spaces that are quite poor in quality in some cases. Not many children have access to parks and playgrounds, probably only at school, if their school has an open space. With older adults as well, unless they have a neighborhood park or a neighborhood organization where they can safely walk outside, a lot of them stay indoors, and that's, again, detrimental to physical and mental health. So one organization that I wanted to highlight that's working in this space is called 880 Cities. And they are guided by a very simple principle that if we do everything in our cities to make the city great for an 8-year-old and an 80-year-old, then it works for everyone. So it's a simple principle, and I think we see that in case studies that I'm going to just show you now. So how can you speak up and advocate for your neighborhoods? Through simple civic changes. So this is an example in the city of Chennai, where I have done some field work. This was introduced by the local municipality, where a flyover was completely closed off between the hours in the morning, between I think 5 and 8 in the morning. And it was completely used by just to walk, cycle. This is a simple change. Neighborhood residents can advocate for this. You can ask your municipalities to make such small interventions. Some other examples of people's power. These are 2 parks in the city of Patna and Aurangabad. Very small, narrow spaces, but they were left over, unused, and just neglected spaces. So the community residents, people living in the apartments nearby, got together, created a proposal, presented it to the municipality, and also then took initiative. So this park was designed by them. They're maintaining it now. So the long-term engagement, that is also important. So these are 2 small examples in cities in India. Another movement that I thought will be interesting to all of you in the health field is called park prescriptions or nature prescriptions. And this movement is growing rapidly in some of the Western nations, especially in the US, in the UK, in some European nations as well, where doctors are prescribing that people who come to them spend time outdoors in nature. And this seems like a no-brainer. It seems like it's very obvious, but it has a lot of power. So as a health professional, when people come to you and they have mobility issues or they have other kinds of medical issues that you're addressing, maybe some time in nature might also help alleviate some of their symptoms. I also wanted to touch upon this because we've all experienced this globally, the COVID-19 pandemic. And unfortunately, the knee-jerk reaction from a lot of governments was to close down public spaces and parks, whereas a high proportion of studies indicated that engaging in physical activity might reduce the risk of COVID-19, hospitalization, and mortality. And being outdoors also means that there is a reduced risk of virus transmissions. So in such cases, when governments were reacting on very limited evidence, I think as health professionals, as urban design professionals, we need to take initiative and present the real evidence to governments to ensure that this doesn't happen again. Because in times of lockdown and quarantining, the only place people can breathe a little bit is to go outdoors and go outside to the park and be active. So the power of parks in a pandemic, these are some examples from cities in India where even during the pandemic, people were taking precautions, but also enjoying the outdoors and being physically active, which really shows you how parks can be used. Another quick slide just showing you how the nature prescriptions work. They usually involve a healthcare provider prescribing a specific nature-based activity. So you could prescribe a walk, some running, community gardening, or some conservation efforts to your patients, which would help improve their health and well-being. I'm part of a study that is actually measuring how effective these are and measuring how health professionals are prescribing this, what barriers they face, and also on the patient side, who is using them, how beneficial they are, and how it's impacting health in the community. One key aspect I also wanted to mention is this is extremely important for persons with disabilities. And the Department of Empowerment of Persons with Disabilities in India had launched an Accessible India campaign in 2015. So it has now been almost 8 or 9 years. And the 3 important verticals in this were built environment. So the first thing was built environment. The second was transportation. And the third was information and communication. And as you can see, there might have been some small changes in some cities, but clearly the built environment and transportation systems have been grossly neglected, not just for adults without, but even for people with disabilities. It is extremely complex for them to navigate our environments, which is why, again, as health professionals, as physiotherapists, it is extremely important for you to campaign on this, to advocate for this, and write about this. So a call to action. So how can you help and how can you be involved? You can join with groups to build a movement for physical activity promotion. Go far and wide. All of you are based in India, I assume, so all over India. You could come up with a catchy campaign slogan, start a promotion of physical activity, which would then inform some of the research and implementation activities. Become vocal and persistent. So making small effective changes like the ones I showed. It could be as simple as asking your municipality to close down a street or using some neglected spaces or park improvements. Share this evidence with those who can use it. Reach out across the field, across disciplines. Reach out to local planners, architects, school officials, and join with others to speak up and demand action. I think the movement has to grow, and when there are more voices, it brings more power. Some examples of implementation. This is also from the Global Action Plan that I mentioned. These are some of the organizations where you can seek out partners. And I would say like-minded partners, because like I'm in the design field, I'm often looking for medical professionals to partner with to start studying how these changes are affecting people's lives. So apart from, ministries, development agencies, intergovernmental organizations, there could be philanthropic foundations, academic and research institutes, or universities in your cities where you could create awareness about this. Also pitch ideas to industry leaders and the private sector. Some non-for-profits. Knock on the doors of your city leaders and local governments. Point out some of the drawbacks in your communities, which neighborhoods. Quite often we complain, if there are potholes, the footpath is broken, but really advocate for it, campaign for it. Things take time to happen, but unless there are voices, it's not going to be heard. So reach out at different levels, and especially in your professional associations in medical and allied health areas. You could reach out to other practicing professionals in nursing, in public health, and find like-minded people to work together. So coming back to the 4 themes that I started with, so creating active societies, this graph will hopefully give you an idea of how you can start making changes. So one example is mass participation events. So if you manage to create a space in your neighborhood, let's say on a weekend where it's completely closed off to automobiles, organize a street market, organize a yoga event, implement social marketing campaigns, expand advocacy, reach out to policymakers, and enhance physical education in schools, maybe start going to schools and talking about the importance of physical activity in the younger age groups. And these are some of the changes that you can start, or some of the interventions that you can start doing and taking initiative to sort of close these loops. So there are many, many ways you can be advocates in your community, and all of these circles represent ways that you can involve yourselves. One project that I will end with, since I spoke a lot about healthy cities, this is a global initiative and it's called healthysustainableCities.org, where we are tracking how cities are performing with their public health goals. So you're welcome to take a look at this website. From India, there's 1 city. So we have a pilot program right now in 25 cities, and we have scorecards to show how cities are doing with their health and sustainability goals. So with that, I will end, and happy to take questions, brainstorm ideas, or even note your observations.
Thank you very much, Dr. Deepti. That's quite an interesting area that you have covered. I think the emphasis is more on physiotherapists coming out of their clinics and hospitals and engage with the community.
Exactly.
Focus more on advocacy. I guess that's the main message. So I invite participants to ask questions or clarification you need. You can type in chat, or you can unmute and speak too.
I will just stop the share so I can look at the chat. If there's anything.
Hello.
Yes.
Yes, this is Dr. Shweta Patel. I'm physiotherapist since 17 years working. But actually, I just wanted to thank you to elaborate these points, as we were aware about this, but actually didn't have the idea that how it is affecting our population. And it would be, I think, very helpful for now programming our patients' fitness schedule, that how we would be having or how we need to take care about their environment as well. Thank you so much for pointing out all this.
I appreciate it. Thank you. I will say that it's this field in general, like I know when I was asked to give this presentation, it is challenging, because as you can see, one of the really I guess difficult things in Indian cities now is air pollution levels. So even if you have a park nearby or access to green space, if you're lucky to have it, the air pollution levels might prevent you from going outside. So that is a systems change, which you and I can't do it alone. We need to work as a group, as a community, to make sure that our cities are developing in a way which is healthy down the road. Otherwise, what good is it that we're urbanizing so fast, but we're not going to live healthy lives?
Definitely, definitely.
Hi, this is Hariom. Am I audible?
Yeah.
Yeah, I just want to point out two things because I'm from Chennai, and there's a pathway which was formed now from Adayar to Besant Nagar, which is sort of a morning pathway where it is closed from 5 o'clock in the morning till 8 o'clock in the morning for heavy traffic, so that it acts as a walkway from Adayar to Besant Nagar
Yeah.
as a health walk area. So that's the good part of it. The sad part of it is the locality where I live, KK Nagar, was selected for a footpath project along with a cycling pathway, like you have in Europe and things like that, with the boulders and things like that, where you cannot park the car. And it had a huge impact because the clinic is my clinic is just exactly opposite to it. We have hundreds of people walking in the morning and evening, but sadly, when the storm drainage project came, they just dug up and the whole thing collapsed. And we had a campaign to write to the collector and the commissioner, not the collector. Sadly, the flooding was more important than walking, I suppose. So, have any ways of overcoming this kind of issues, I suppose?
Yeah, this is an issue. And I think, again, not to, make excuses, but the problem is the right hand is not talking to the left hand, I think, within the Corporation of Chennai. And I have presented some of my work as well to the commissioner. He's very receptive to ideas. He listens. I think it involves bringing the heads of those different agencies together. So the agency that implemented the walking track and the pedestrian infrastructure versus sort of the flood management agency. I think, if there's a little bit of foresight, then the flood management could have been done before, and then the infrastructure could have been laid after. But this is a key issue. And I think the more as citizens, we need to demand our officials to take responsibility. So that is also important. I think you were on the right track by raising this with the commissioner. I would say continue to do that. I know it is discouraging. I've experienced it myself. But unless we keep working sincerely and continuously on these issues, we're not going to make progress. So progress is slow. I will say that.
Yeah, thank you so much.
Hello.
Yes.
Good evening. I'm Thangamani Ramalingam from Surat.
Yeah.
I'm a physiotherapist. I have only two questions, ma'am.
Yeah.
One is that to what extent the global factors which are controlling or affecting the physical activity to will be suitable for the Indian context? Number one question. Number two, environmental constraints and professional approach, everything I could able to understand. To what extent the cultural factors could play a role in improving the physical activity of the people? Because compared to West, no, there more space, less people. Here, less space, more people. Then how come that factors of the West will be applicable straight away to this? To the Indian context, especially even I feel that they use the car to cover the distance. But why we use the car, I don't know. Even though we have less distance, we use the car. These kind of things, how it could affect the physical activity level of the society.
Exactly.
Thank you.
Yeah, these are excellent questions, because I have myself examined these in my PhD when I was doing it. So to start with your first question, how Western factors, they're not directly applicable. They're completely not. And I've studied that. So even with the walkability study that I showed you, the tool that I developed, it was adapted for the Indian context. And your second question actually ties into that, because for us, our cultural and social factors play a much more important role than, I would say, individual factors. So, for example, I can say when I was doing my study, surveying older adults in the community, a lot of them, they are active in groups and they have friends. So their social support system is more important to them than the activity they're getting when they go out to walk in the park. But that social support and the network of friends acts as an incentive. So that's why I think when I was mentioning in my slides, the social environment is also highlighted as a key factor. But so that's on the side of relationships and social network building. Where I see we are blindly copying the Western principles is the way we are designing our cities. And relying on your private car or your private automobile, in a Western context, say in the US, the cities are designed that way. They are large, expansive, they have suburbs built everywhere. So they've designed their cities to rely on cars, but that doesn't mean we have to follow the same thing. And I think in India, you can correct me if I'm wrong, but the car is a symbol of social status. The more cars you have, the more you feel good about it.
Good.
And it's not just cars, now it's even motorbikes.
Yes.
And if we go back in time, even in, I would say, the 1960s or 70s, India was a cycling country. And that has slowly changed with this really mass invasion of automobiles. And of course, it is tied. There are also, I would say, in addition to cultural and social factors, there are economic factors and political factors at play here, because a lot of the automobile industries are connected with this in our environments. So I would say, as the more you're aware of this and the more you're spreading awareness in your communities, reducing the reliance on the car. I'm not saying completely go, you don't need a car, but what I'm saying is in moderation. Everything has to be in moderation. So your neighborhoods should be able to give you the choice that if you can and want to walk to the supermarket, you have a safe and accessible route where you can walk. If your children want to bike to school, they should be able to do that. Not that you are forced to just completely get into the car and drive everywhere. But sadly, I see that that's where we are copying the West.
Yes, ma'am. Thank you very much.
Yeah, I see a comment. Opting for public transportation helps in reducing pollution and traffic issues. Exactly. Yeah. If you look at the last slide that I shared, healthy, sustainable cities, we are measuring all of that. We're measuring whether cities are allowing access to public transportation, how their infrastructure is designed, and how many citizens are actually using public transportation and what the air pollution levels are.
Is there anyone else would like to ask question or make a comment?
Prakash, can I ask one more?
Yeah, sure.
So I hear some of the Western countries are trying to make public transport free so that more people use it. Also, I think a lot of students get it for free. We also have a program like that in Tamil Nadu also, where it's free for women. Has it made an impact on? Is there any data to show that has it made any impact on people being more active or
Yeah.
anything substantial?
Actually, that is one of the questions that I'm interested in studying. It's not just in Tamil Nadu, in Maharashtra as well. Buses are free, I think, for women. So
No, it's in
this
Karnataka.
in Karnataka as well. Okay. So a lot of states seem to be doing it, which would be an excellent research study, I think. So I will look into this, but my initial guess is, at least I can speak from my experience in Chennai, and this goes back to the social status question. I don't know many people who, in middle or high income families who would use the bus. Maybe the metro. Chennai has a new metro system, and that is being widely used. But it would be an interesting study. I think there will be data on it, and some organizations might be tracking it. There is the Institute for Transportation and Development Policy, ITDP in India. So I personally don't know if the data is there available yet, but I'm sure it will be tracked.
Okay, thank you.
Hi, my name is Vasantan. We do have, I heard about increasing the activity, level of activity. Are there any studies which you have been personally involved in increasing different dimensions of that activity? For example, when we ask people, do you do activity? Many of them tell that, yeah, I'm physically active. And then when we ask what type of activity you do, I do walk. That's the answer we get. But just walking alone is not going to be important. It's what's the speed at which they walk. And those kind of aspects are there. So are there any things in the urban design which can go beyond just increasing the amount of space available for walking?
Yeah, I think there are ways to do that. One of the initiatives I've seen in India is outdoor gyms. So within parks, you see equipment that's being installed. And every time I have gone to a park in different cities in India, whether it's Chennai, Mumbai, in Pune, these are some of the cities I have visited. All of those equipments are being used. All of that equipment is being used very well. And they could be, bars or hip rotation equipment. So I also noticed that they're being used a lot by women who may not have access to or time to go to the gym or resources. And in several neighborhoods where this is introduced, a lot of the low-income sector as well is able to use them. So this would be one way where different dimensions of physical activity can be improved. And this is where I think your work as physiotherapists and advocating for these in parks and open spaces, like if you could write to your local commissioners and tell them that this is important and people need this equipment, that would be great, because then a lot of other parks would be installing them. And same thing I think goes for protected cycle lanes. A lot of activity, it's a different type of activity, cycling, but I'm sure it impacts a different dimension. You're the expert on that, so you will know that. So apart from walking, cycling, outdoor gyms, those are some of the ways I think where design plays a role.
Thank you.
Hello, ma'am.
Yeah.
May I ask you?
Your voice is breaking up a little. Oh. I think that was Vandana.
Yeah. Vandana, are you there?
Yes, sir. So the voice is breaking, I think so.
That's all right. You can ask now. We can hear you now.
Okay. Ma'am, for mobility, specifically perception of the people are very different. So how can we work out on that?
Yeah, you mean, for example, perception of how they feel, whether they feel safe or comfortable exercising.
Yes, ma'am. And some
Yeah.
believe in some activities, other people believe, like for example, some people will say I'm comfortable with only walking. Some people will feel that I'm comfortable only with the pranayam yoga. Some people will comfortable with only their own activities.
Yeah.
So this is very like broad thing.
Yeah, I would say a lot of this has to do with providing support and awareness. So you can encourage them to try a different type of activity. You can encourage them to meet others who are doing the other activity that you want them to try. That's where the social support, I think, plays a greater role. If they see others, either in their family or wider social network, also trying those activities, that can be a good pathway. Finding neighborhood groups that encourage those activities might help.
Okay, ma'am. Thank you.
Excuse me, I do have one more question.
Sure.
You had spoken a lot about how intervening at the level of the environment and at the level of the society, policies and all these things are going to work. My question is, how much can an individual do? For example, I'm a physiotherapist and I'm going to a patient's home and I see that he's having a limited ability to walk and I want to improve it, right? So if you want to make modifications, right, simple modifications, what kind of modifications do help to improve the activity in terms of environment, since you're working more with that area? Have there been success stories?
Yeah, that is a tricky one because it also depends on the individual's home environment, where they're living, also what kind of support they have. And sometimes people don't have access to parks and green spaces in their immediate neighborhood. So then they have to depend on someone to either drive them to that space. So this becomes complex, especially in our context, which is why working with broader municipal officials, if you have the time and space, that matters. Or I would say even making sure that they're stepping out of the house and even at least walking within their street at certain times of the day where there might be slow periods of traffic. Encouraging their neighbors, maybe if they have a good social network, to work with them and help them improve their mobility, whether it's walking outside slowly at certain times of the day. Those could be some ways. But yes, this is an important aspect, and that's why the role of the neighborhood is so important, especially with older adults, I think.
Do you have any data on how much percentage approximately individual level interventions might be helpful?
I don't remember it right away, but I'm sure I can find it. If you would like to email me, I can find the data, because I know from recent research that the environment can help at least up to 25 to 30%. But on the individual side, I'm sure it will be higher.
Thank you so much.
Right. Just one question from my side. You mentioned about land use mix diversity as one of the factor that influences it. Can you just elaborate on what you actually mean by that?
Yeah. So land use mix is it's an urban design planning term which we use to indicate what mix of uses or amenities there are in your neighborhood. Whether you can easily access a supermarket, a school, things you need for your everyday life, like a pharmacy, a park or green space, a library, and your everyday needs, like, banking institution, a post office. So all those kinds of amenities, whether they are within a certain kilometer radius around your home. And that's called a diversity of uses that are available.
Right. Do you have time? Can I ask another follow-up?
Of course, yeah.
Sure. See, I work especially in the community mobility area, where with patients with stroke. I did a study on transportation use among rural, right? It was interesting in terms of what type of transport they use, and walking as a mode of transport seems to be one of the common in rural, which they have used. But at the end of the study, when I looked at study conclusion and so on, I left wondering, so what am I going to do? I'm as a physiotherapist, these are all the limitations that I have found. There's pretty good data on what challenges that they face. While I was initially interested in doing it, because I know that that's one of the key factors that stops them from moving to places. So I just want to know, so where do you think physiotherapists can fit in, say, if they have a transportation problem? You've been saying so far in terms of talking with policymakers and so on and so forth. So is there any other ways where we might partner with other professionals to come up with some simple solution which can be addressed at the individual level? Is that even possible?
I think it's possible. I mean, even simple ideas like talking to architects as they're designing buildings.
Right.
Quite often, they ignore even simple things like ramps. And they don't think about what happens, 20, 30 years down the line when they're designing for a young family.
Yeah.
So I think just making those kinds of conversations and bringing more, I think awareness is a start, but really encouraging them to implement those, because it's those kinds of built environment changes. It's also hard to make once the building is built. So reminding them that if they do it now, it's probably going to save the owners and also the professionals a lot of hassle later on. So paying attention to universal accessibility is a key issue. And I'm sure in India, there's an association of physiotherapists at the national level. I would say, so at the smaller scale, like I said, talking to architects, planners, designers. At the larger scale, I would say start, advocating for this right. Even it could just be a one-page call to action. And if it comes from the Association of Physiotherapists, present it to the Ministry of Health. Those kinds of impacts can go a long way, because if all of you come together as a group and talk about the importance of this, that will open at least the doors for conversations between the Ministry of Health, Ministry of Urban Development, and start, those conversations at the policy level as well.
Okay, thank you. If we don't have any more questions, I think we can end our webinar here. Again, thank you so much for accepting my invitation and spending your time both in preparing and delivering this work. This is really an interesting area. I'm sure most of us have, it made us think, I would say, into the broader, more comprehensive way of looking at the problem rather than just focusing on one part. Again, thank you very much.
I appreciate it. And thank you again for the invitation, and I encourage all of you to be advocates for active mobility.
Pleasure.
Yeah, thank you.